Daily exercise with Danica. Today we're going to do a sequence, a very moderate sequence for sciatica. So if you are experiencing sciatica, please make sure that you see a physician before starting any exercise program. You wouldn't want to do any exercises that will cause any nerve damage or any irreparable damage. So please seek medical advice before starting any exercise program. Today we're going to use a chair and a strap, and these are very restorative exercises. We're just going to do a few that will hopefully alleviate some of the sciatic symptoms that you may be experiencing. So let's go ahead and lie down on our back to begin with the legs on the chair. So we want those legs supported and those arms open so the palms are facing up. Let's just take a few long deep breaths to really create space in that spine. So as we breathe in, imagine the spine from the top of the head to the tailbone is getting longer with that breath. And as we breathe out, we're able to draw our awareness and strength to that core center and belly. But we're staying very relaxed in the low back, just working more to create any space and length that we can in the hips and low back. So for some, you may want to just stay in this position. It may feel good, it may feel pain-free, so feel free to just hang out with those knees on the chair and just relax. Feels great after a long day of work too, or long day of whatever it is you're doing, to just put your legs up on the chair and just let that spine relax. So if you're ready to move on, take that strap and we're going to place it around the ball of the foot. Now that opposite leg is just going to stay resting on the chair, and we're going to begin to straighten that leg out if it feels okay. For some, it may irritate that sciatica to straighten the knee completely, so hold it where it feels most comfortable. For some, it may be you're down here. No forcing the movement. We just want to hold where we feel a nice stretch down the back of the leg. Many times tight hamstrings can cause piriformis syndrome, which can cause sciatic pain. So stretching those hamstrings, which get really tight throughout the day with all of our sitting and driving and everything that we're doing, those tight hamstrings can be problematic for the low back. So let's stretch them out every day. We want to breathe deeply while we're stretching and never overstretch. The breathing allows the body to relax a little bit more. And amazing. Let's switch sides now. So we're just going to put that strap right in the other foot. Really relax that opposing leg. The legs on the chair help keep that pelvis neutral and in a place that the back and the core isn't really having to work right now. We can just allow the muscles to sort of feel supported by the floor in this position and allowing them to take a little break. So pushing gently through the heel. Again, we're not forcing any movement here. We want to be relaxed in the shoulders. We want to be aware of our breath and aware of that stretch. Nice long deep breaths and reminding ourselves not to overstretch. Even if it feels good to push it a little bit, let's not overstretch. We don't want to create any more scar tissue or adhesions to our fascia that may cause more problems. Just want to hold that stretch in a nice peaceful place. And release. Sort of reset. We'll bring both knees back down. Put that strap to the side. Let's stretch those arms overhead if that feels okay. Just to kind of release any tension in those shoulders if we have any from holding that strap. Bring those arms back down. Now we're going into a glute or piriformis stretch. So we can just cross one leg over from here. So for some of you, this may feel really good just in this position here. So this is step one. Step two is taking that supporting leg and bringing the heel to the edge of that chair. We should feel a nice enhancement in that stretch here, but staying very relaxed in the upper body. So you want to work on deepening the breath and maybe working to bring the breath down to the hip as if we're creating more space in that hip with the breath. Nice and long and strong. Stay here as long as you want. For a few more deep breaths, we'll switch sides, but feel free to hang out here a little longer if you want. Maybe enhancing the stretch a little bit more by sliding that foot off and even lifting that heel just a little bit, an inch, you'll feel an enhancement in that stretch. Now again, it's okay to push yourselves a little bit, but you don't want to overdo it and cause any micro tearing. We want to work on lengthening without damaging that muscle. Now we'll release back to that original position here, and then go ahead and stretch the leg out. So in between, let's stretch those arms overhead. Just get that blood flowing through those arms and shoulders. We'll bring the arms back down and cross the other side. Now hang out here for just a minute. Each side is usually a little different. So if this side is tighter and you want to stay in this position, please do. Or we'll slide that foot toward the edge of the chair and feel that enhanced stretch. Meanwhile, we're staying very relaxed in that upper body. So it may feel a little bit tighter or looser on this side. Notice the differences between the two sides. Bring awareness back to the breathing. Again, creating that length on the inhalation, maybe pulling it all the way down to that hip. And as we breathe out, we release and relax. Check in with the head, neck, and shoulders. Make sure you're not holding any tension there. Holding it for a few more long breaths. And remember you can take these stretches and hold them a little longer if you'd like, and just kind of play around with it. Do what feels best for your body, always. We'll begin to move that supporting leg back to the chair. And we'll end with both legs on that chair. Inhale, reach those arms overhead one more time. And then bring the arms back down. So I'm going to go ahead and leave you here in this comfortable position to just enjoy the moment, maybe focus again on the breath, feel maybe the sense of awareness, a little more loose in those hips. So before coming all the way up, you can stay and relax in this position. As we transition out of this position, stay as long as you want, but when you're ready to come out of it, we're going to bring the feet down and roll over to one side. And then push up slowly from that side, just allowing that blood to redistribute and taking that pressure rather than rolling straight up. We want to take it to the side and then come up from the side. Roll the shoulders back a few times. Let that blood redistribute. Take a giant breath up and exhale. So I recommend doing that as often as possible, even a couple times a day if you're feeling a little bit more of that sciatic pain. Take everything at your own pace. Have a great day, and thank you for joining. I will see you again soon. Thank you.